Good morning, and thank you all for joining us today. My name is Peter Morta with the SCV Chamber of Commerce, and I'm pleased to welcome you. Before we get started, I have a couple of housekeeping items I'd like to go over. Throughout the webinar, please use the questions feature in your control panel to submit any questions that you have. We will be answering them at the end of the webinar. If you have any issues, please email hello@scvchamber.com. We'll be monitoring that throughout the webinar. If you haven't had a chance, check out our upcoming virtual programs this week by visiting www.scvchamber.com and clicking on our events tab. This week, we have our nonprofit seminar, which is sponsored by LBW Insurance, and we're going to be discussing legal aspects and fundraising in a COVID-19 world. We also have our Tele Town Hall in partnership with the Office of Assemblywoman Christy Smith and Insurance Commissioner Ricardo Lara. Today's webinar, we're pleased to have Dr. Chris Raigosa with Kaiser Permanente. Dr. Raigosa, physician in charge at Kaiser, will be presenting Kaiser's 98-page playbook for businesses returning to the office. With input from the CDC, OSHA and LA County health departments, hear about what best practices are needed as we move into the next phase of reopening our economy. The playbook includes information such as reconfiguring office space, having a process in place if an employee is diagnosed with COVID-19, evaluating absence policies, and reinforcing a psychologically healthy workplace where employees feel safe, respected, and empowered. With Kaiser's health system's 12.4 million members nationally, which includes employees at 14,400 large and 74,000 small businesses, they have vested an interest in preventing a resurgence of the virus while acknowledging that professional life and productivity will look different than it did before the COVID-19 pandemic. With that, Dr. Raigosa, I'll turn it over to you.
Great, thank you, Peter, and thank you for this opportunity to be here today to talk about COVID, what COVID's about, and what's that new normal going to look like as we open our economy up and navigate through this. I want to first start. You can advance the slide, please. Thank you. Next slide. Thank you. So first, it's really about managing. The purpose of today's talk is we have this playbook that we've created that will look at how we're going to navigate through the COVID crisis in the recovery phase. Certainly, Peter, you mentioned it was a 98-page playbook. I'm not going to present 98 pages worth of data. I'm just going to go over the highlights, and then we'll have the information here at the conclusion of the presentation that you can reference on the chamber site. So today's goal is really just to go over COVID, where we are currently with COVID-19, and then we'll go into some strategies that we can employ in the workplace to mitigate the risk and address the concerns as we move forward. Next slide. And next slide, one more slide. All right, so I first want to talk a little bit about where we are today just with COVID, the current state of COVID-19. We've all have heard that there's recent, as we begin reopening the economy, that we're starting to see surges across the country. And the reality is, while some states are seeing decreases, and those are mainly on the East Coast, 23 states are now seeing average increases in the daily number of new cases. And so what can account for that? What could account for that is increase in testing availabilities and or true increase in transmission of COVID-19 as we've begun reopening the economy, with many states opening in early May and some as early as late April. So the reality is, the COVID-19 is not going away, and is not going away anytime soon. It'll likely we'll see a somewhat of a resurgence as we move forward. And contrary to what people think, or people have said, the climate is not necessarily going to impact significantly its transmission. So with the warming of the weather in the summer months, I think we are still going to be seeing a steady rate of COVID-19 diagnosis, hospitalizations, and deaths as we move forward. So we really have to be thinking about how we're going to be operating in this new normal. Next slide. So where are we with treatment, testing, and and prevention. So there's since the moment that COVID came to our landed on our doorstep, there have been tons of studies that have been looking at different ways to treat COVID, and the outpatient setting, and the inpatient setting, and the ICU setting. And so while many of them haven't shown to be successful, there has been one study that actually did show a significant improvement in health outcomes in patients that are receiving the drug remdesivir. And so it was the improvement was so striking that the FDA quickly approved for emergency use back in the beginning of May. And while there's still some clinical trials ongoing with a whole host of other medications and treatments, right now remdesivir is the one that has been shown to be the most effective in the inpatient and hospitalized setting. Currently, there's no really good outpatient treatment of COVID-19. The testing is, there's different forms of testing. There's the RNA test, which the PCR test, which is the one that was initially used, and it's still being used to diagnose active COVID infections. And that's the one that you're seeing if you're ordering, if your patient is having symptoms of COVID or concerned about COVID, and that's the one that you can detect the COVID RNA and diagnose the patient either having COVID or not having COVID. However, it does have some limitations I'll go over next. And then there's a new phase of testing that we're actively seeing an increase, and that's the antibody testing. And while we're seeing an increase in the number of people and patients asking for the antibody testing, it's still of limited use because there are some limitations to the study. It's really seen primarily as an epidemiological tool, just to better understand the prevalence within the community and what's going on with immunity in the population. And then there's the vaccine. Ultimately, the way we'll work through COVID is through vaccinations. And so while there are many vaccines being currently studied, there's one that is showing some promise. It's the Moderna vaccine, and hopefully, by the end of the year, beginning in January, we should have several choices to help prevent COVID disease. So we're looking forward to that when that day comes. But in the meantime, this is where we are, the state of treatment, testing, and vaccination. Next slide. So with regard to the antibody testing, this is a blood test that detects on whether or not you possess the antibody that to the COVID virus. So it's really used just to determine the prevalence. And while we think in the end we will be able to use it to figure out who's immune to COVID, right now we don't have that reliability in the testing results and interpretation of those results. There are lots of false negatives with the antibody test. There are a lot of false positives. False positive meaning it may show up as you having an antibody, but you never really were positive. You never had COVID. And false negatives might mean you may have had COVID and still test antibody negative. So we're still trying to figure out what's the utility of using this test. So lots of information will evolve in the next several months about antibody testing, and so we'll definitely have to be on the lookout for that. Next slide. Okay, thank you. Currently, we're looking at about 2.8 to 5.6% of antibody tests positive. So it's for herd immunity. It's a term we use in medicine when to figure out what is the percentage of people with immunity to a particular disease, so that you are immune because the rest of the herd is immune. So we need about 70% for that to take place, and right now we're nowhere near that. We're in the fives, in the low single digits of herd immunity. New York is getting there with maybe 1 in 5 people showing some immunity to it. So we're still got a ways to go with herd immunity. All right, and let's go to the next slide, Peter. All right, and so there's been a lot of talk recently about children in COVID-19 and where we are with that. And here's a graph about what's going on in the pediatric population. So in the left is a pie graph that shows what percentage of positive COVID-19 cases among children, where are they falling? As you can see, that most of the cases are falling in the older children, in the 15 to 17 age group, and in the 10 to 14 age group, where there seems to be some protection in the younger, afforded to by younger age and younger children. And the patients who are children tend to show less symptoms and less disease, as you can expect. They tend to have less chronic conditions that might complicate the COVID-19 infection. So on the right, you can see that as compared to adults in the light blue, children in the dark blue show much lower rates of the symptoms that are generally considered to be related with COVID-19, right? Fever, cough, and shortness of breath. And those that are positive tend to also have some other underlying condition, whether it be a respiratory condition or maybe they're immunosuppressed because they're undergoing some cancer treatment. Those are the risk factors that we're starting to see in children. Next slide. And then if you've been really listening to the news lately, the real risk in children is it's a rare complication, but it's called the multi-inflammatory syndrome, multi-system inflammatory syndrome in children. It's similar to a condition called Kawasaki's disease, and it tends to occur about a month after COVID-19 infection. And it's an inflammatory condition that occurs all over the body, and if it's not treated effectively, can result in some serious bodily injury. So we are always on the lookout for that as well. So that's that is really the areas that are really concerning for the children and what that risk is looking like. But most of the complications in COVID certainly are coming to the adults, and those adults that are having chronic conditions like diabetes, obesity, hypertension, and are over 65. All right, next slide. So how does this disease spread? Well, the disease is spread through these respiratory droplets. They're tiny droplets that are suspended in the respiratory secretion. So if you sneeze, you cough, it goes out into the air. Here's a great example of what that looks like. These droplets tend to travel just a few feet, and then they fall to the floor within about a minute. So, and then these rates the transmission or the virus, these particles can increase dramatically if you're talking a lot or you're singing, and they seem to be the perfect way to project these droplets over long distances. That's why it's so important to use these mitigation strategies, including covering your face with a mask. We'll go over that in just a little bit. So there's a lot of questions and concerns about what is the infectious dose of COVID-19. So the reality is, if you came in contact with one virus particle, that's not going to make you sick, not even 100. It's looking like it's about 1,000 virus particles that are needed for you to obtain the COVID-19 infection. And so let's put this into context. You know, you need to breathe in the exhaled air from about 10 breaths for you to hit that minimum number of virus particles for you to be able to catch it. And so that's why it's so important. Masks do a really good job of catching these exhaled droplets and preventing them from progressing out into your space. With regard to what's better, inside or outside, I mean, I think it's pretty obvious that the outside air tends to dissipate the droplets, encourages evaporation. And so it's very rare to catch COVID-19 if you're outside, because these droplets, they don't survive very long. Closed spaces, indoor spaces with a lot of people tend to be perfect opportunities for this virus to spread, because it just tends to hang in the air a little longer. Okay, next slide. All right, I want to go into switch gears to what the pandemic response is going to be like, and then we'll go into the strategies you can ultimately employ in your workplace to help mitigate the effects. Next slide, Peter. this is where we are, where we were with regard to our pandemic response. In the initial phase, it's containment. This was back in early February or mid-February, where those first cases were being reported. And in the containment phase of a pandemic response, you're looking to hopefully quickly isolate those that are ill, quarantine them, identify them quickly, and surround them with the resources to figure out who they came in contact with through contact tracing. When that fails, as it did, we moved on to mitigation. Mitigation is where we were from, I would say, early March through mid-May. Mitigation where you're really trying to employ these broad-based measures to get a handle on the disease spread. Venues were closed, schools were closed, events were canceled. People were told to shelter in place and physically distance. And then as you work out of the mitigation phase, you move on to the suppression phase, which is where we were or where we are over the last several weeks, where transmission kind of slowed. And then there's better testing availability. People understand how the disease works and are self-quarantining. You still are doing contact tracing, and you're really focusing on prevention. And then in the end, it's going to be where we have extensive testing and vaccine availability so that we can vaccinate everybody that needs vaccination. And so it's important to know, as in the next slide, Peter, it's important to know that we usually will often loop back from containment to mitigate, to suppress, then back to containment and mitigate, suppress, until the very end, where we have a very successful prevention response. So I think as the current history is now showing us, we went through containment phase, we attempted to mitigate, and we got control of it. Now we entered the suppression phase, and as we're starting to see that some cases are starting to bubble up now and going and increasing, we'll likely revert back to some of the earlier interventions as containment and mitigation, and we'll be in this cycle for months until we have that vaccine or an effective outpatient treatment. All right, next slide. All right, and so what's so important about contact tracing? So this is a public health measure, intervention, I should say, where you identify people who actually have COVID-19, figure out who they came in close contact with, and we'll go over that definition of close contact in just a sec. And then you contact everyone who came in close contact to let them know that they were at significant risk for catching COVID-19, quarantine them, self-isolate them for a period of time, and support those individuals. And that's how you suppress the rate of spread of COVID-19. So COVID-19 close contacts, next slide, is defined by being within 6 feet of an infected person for at least 15 minutes, starting from 48 hours before the illness onset until the time the patient is isolated. So you can see it's not like you're just walking through a room and you're going to catch COVID. It's prolonged contact with an infected member with COVID, affected individual with COVID, and being within their close space within 6 feet. This is why it spreads so easily in households, and because the households tend to congregate with each other and breach the 6 foot space. So we have to really be aware of how this disease spreads. So close contact, this is how public health defines it, and this is what we use to assess an individual's risk. Next slide. And this is a really important slide because it's what's true with COVID is that asymptomatic persons account for approximately 40 to 45% of the COVID infections, and they can transmit the virus to others for an extended period of time. They transmit even before they have symptoms. So this is why this disease is it's so difficult to treat, because you have this period of time, many days, it's 2 to 3 days, some cases up to 5 days where you have no symptoms and you are spreading it. So that's why it took root quickly. Next slide. Thank you, Peter. So containment guidelines after you're testing positive. So this is what how we're approaching patients who are positive. They have a positive test. They either have symptoms or they don't have symptoms. You isolate them at home and you wait. You wait at least 10 days if they're wanting to go back to work or come back into interact in society. You're waiting at least 10 days after the symptoms started, and you wait 72 hours after the main symptom is fever until fever has resolved and the respiratory symptoms are improving. So this is probably the most effective way to assess whether a patient has cleared COVID. We'll go into why the test is not necessarily the best way, the retest, I should say. But this is likely the best way to figure out if someone has cleared COVID. And then if they have no symptoms, you just wait 10 days after they had the first positive diagnostic test if the symptoms don't develop. So this is how these are the guidelines for containment of patients with COVID. Next slide. So we often look to our federal agencies to give us guidance on how to proceed through the COVID epidemic. And these are the reopening guidelines for businesses and communities. I would say currently we are right in the middle of phase 2 of reopening. And so this is where with regard to individuals, we have the vulnerable populations are still sheltering when they can. The public, we're trying to really maximize physical distancing. We've increased the socializations of individuals so they don't necessarily have to limit themselves to less than 10 people. We're opening restaurants, we're opening gyms. Some venues are starting to see people. So I think we're in this phase 2 of reopening, and hopefully once we get a handle on COVID, we can safely move into phase 3, where really there's very little effect on or impact on our daily lives. Next slide. All right, so I'm going to change gears a little bit. That's really that's really where we are with COVID now, and what's happening with COVID. I can actually give a little information with regard to our what we're seeing at Kaiser Permanente across our program. We saw over the last several weeks, we saw a relative lowest level of hospitalizations and admissions, and I would say in the last 6 or 7 days, we're starting to see a little bump up in hospitalizations, ICU and ICU admissions. So we're concerned about what that might mean for the summer and with regard to COVID-19 as it moves forward. So we're hopefully going to keep a very close eye on that. All right, I'm going to move on to the kind of understanding what we can do at the workplace and talk a little bit about a framework for where we are. Some of the key takeaways in this next phase is how can we modify the workplace and the safety plans for COVID-19? And really it's going to be evolve around mitigating risks of transmission. We're going to be using the employee sanitation, environmental sanitation, and some other containment strategies. So on the right, you see that 91%, this is a Mercer survey regarding COVID-19, 91% of employers are taking some sort of action to protect their workplace. And they could be something as simple as just disinfecting or cleaning their workspaces. And 62% are providing their employees with masks. So people have received the message and taken it seriously, employers as well. 1/3 of all patients that are surveyed are planning to perform some type of health screening on site, and the most common form of health screening are temperature checks and questionnaire or self-assessments. I know we're doing this at our health facility. Anybody that walks into the office is scanned with an infrared temperature scanner, and if they are asked questions regarding COVID, fever, chills, shortness of breath, recent travel, or exposure to anybody that has COVID in the home or has been tested recently for COVID. So we're trying to really get a handle on who comes into our space, and I think that employers are wanting to do that as well. Next slide. All right, so the risk mitigation falls on 3 really strategies: employee sanitation, which includes washing hands, wearing masks, environmental sanitation, which is a more rigorous approach to disinfecting the workspace, and then getting a handle on those that are sick and that have tested positive for COVID, and providing them with a policy at work that allows them to stay at home and not feel the need to come into the workspace. Next slide. So what can we do to sanitize the workspace? Frequent hand washing, making sure we have hand sanitizer, multiple locations and readily easily accessible, universal masking wherever possible, and just have a dialogue with the employees about respiratory etiquette, how to cover your cough, improving the spacing between workstations, and really trying to limit the gatherings of in the public, large gatherings of people. So providing an environment that's supportive of that is going to be key in the workspace to get through this. Next slide. How to wear a mask. This is we've seen a lot of different approaches on how to wear a mask. So the first thing you need to do is you got to make sure you wash your hands before you put the mask on. The mask goes on over your nose and your mouth and underneath the chin, and you got to make sure it's nice and snug and fits nicely. And that the colored side, if you're wearing like a procedure or a cover your cough type of mask, that if it's colored, make sure the color is facing out, because usually the inside is the white part, and that's where it tends to catch your secretions. It's also important to know that most masks, other than the medical grade ones, are designed to protect others from you, as opposed to the N95 respirators, which we as physicians and healthcare workers wear, are designed to prevent us from acquiring the COVID-19. So it's a little different. So what you're trying to do with your mask is just to cover any secretions that might potentially harbor the COVID-19 virus. You gotta make sure it fits nicely, pinch it around your nose, and then don't touch your face. That's the biggest fallacy that tends to happen. People will touch their mask on the outside part, and then they'll touch their eyes. So we really need to really stress the importance of, once your mask is on, you're not touching your face, and you're going to keep your hands constantly clean through hand washing, and so that you don't, because so it doesn't enter your mucous membranes, which line your eyes, which line the inside of your nose, which line your mouth, and those are the access points for the virus to enter your body. So we really try and want to either cover them or prevent anything from touching them. Okay. Next slide. And then we talked about this, routine cleaning and disinfecting of your workspace is going to be important. Next slide. And then make sure that we're isolating the exposure to the virus. You're screening individuals as they come into your workspace. You're asking them about, have they had any symptoms recently? If you have a scanner, you're scanning them or taking their temperature. If they had anybody that's positive, you want to make sure that they have conversations with their healthcare providers, so that other individuals in their family can consider screening for the illness as well. Make sure your sick day policies and procedures are in place. So the last thing you want to do is have an environment where you're encouraging people to come to work sick, and you want to make sure that they stay home, because the last thing you want is that virus to spread in your workspace. And that you have some isolation protocols about when people test positive in going home. If you have your business is the healthcare where you need to isolate people that come into your workspace. Okay, next slide. A very effective strategy that many businesses employ is having a forum that allows for people to communicate health and safety guidelines clearly and frequently. So example of what we do is I host a bi-weekly quick 20-minute forum on what's going on with COVID and the current state of events. And we talk about how are we mitigating the transmission. And many workplaces can do that through their Zoom meetings or webinars, have conversations with each other, so that people can understand how to limit the spread. With regard to hand wash, hand hygiene. What do you do if you have symptoms? Who do you go see? So it helps to really try and get a handle on this ahead of time. Next slide. If your business is one that requires lots of travel, you clearly want to take advantage of the websites and federal agencies that talk about what's going on with travelers' health and the health notices. You'll want to know which states are seeing an uptick, which states are seeing a downtick, where is it safer to travel, how to travel safely, whether it be via train, bus, flights. So we really try and get a handle on what your employees might need, what information they might need to safely travel. And then the next slide, Peter. And the next few slides are here. It's just, I'm not going to go over these specifically, but we've included some safety checklists that you can look into and employ in your workspace so that you have a way of mitigating the disease spread. And then next slide. These are just resources for you with regard to safety and work comp. All right. So I want to move on to our next chapter in our playbook, which involves returning to work safely and what does it look like. Next slide. Thanks. All right, and so this is a really hot topic. I think that we as physicians have to deal with a lot. We have patients that have tested positive, and their employer is asking, "Hey, when can they return to work?" And so a lot of employers are really demanding a retest of their employers before they go back to work as a form of clearance before you go back. So when individuals' symptoms can return to work, you can either employ a symptom-based strategy or a test-based strategy. And I'm telling you the symptom-based strategy is likely the more effective approach. And I'll explain why in a sec. Again, this was a symptom-based strategy is they were diagnosed with either a COVID-19 test over 10 days ago, and they've been symptom-free for the last 3 days, at least for 3 days from their recovery. That is someone that is cleared to go back to work. The test-based strategy is a retest. You have no symptoms. Respiratory symptoms actually are improving, but no fever. And the employers are asking for 2 negative tests more than 24 hours apart. So the limitation with the test-based strategy is that that oftentimes patients will have recovered from COVID and still test positive because the test is not it's actually looking for virus particles. And they're RNA particles. And oftentimes your body has cleared them, but you still have evidence or presence of dead virus particles in your respiratory tract. And the test will pick it up as positive and that you won't necessarily be cleared if you're using the strategy to go back to work. So there's that's one of the limitations of the study. And it can be positive for weeks. You can still test positive weeks after you've actually cleared the COVID-19. And so that's one of the main limitations with the retest strategy for returning to work. And then individuals without symptoms can return to work if it's been more than 10 days since the symptom, since that first positive test, or if you've been quarantined more than 14 days since your last exposure. Okay, next slide. This is where we were with COVID-19 in the early days. We really had to prioritize the COVID-19 testing. I don't think it applies as much as it did back then, where you really were trying to ration, if you will, the tests because we didn't have very many, and you prioritize the testing for high priority patients like hospitalized patients or people workers in congregate living facilities or healthcare workers. But I think now we can pretty much test anybody that has symptoms of COVID-19, and I think the wide-scale testing availability is expanded now to involve asymptomatic testing, so which is great, which is really what you need to get a handle on this this disease. Next. And so there's with regard to employee screening with COVID-19. If you wanted to, employers can require COVID-19 testing. You want to make sure you screen everyone with the same role equally. One of the best screening guidance that I recommend is taking the temperatures at the work site. And the cutoff temperature we use is 100.0. You're below 100 and you have no symptoms, you likely don't have COVID. You're above 100 and you have any symptoms, or even if you just have one of those things where you're above 100 degrees and you have no symptoms, the recommendation is to keep those employees or people home and not at the workplace, because their risk is increased for having COVID. And then if they do make sure you mandate or you advise them to be tested or to be seen by their healthcare providers. So we really want to get a handle on the COVID-19 in the workplace. All right, next slide. Guidance around sick days. And let me pull it here. What do you, what are you're kind of limited by what you can request an employee who calls in sick. I think oftentimes we as providers are asked, hey, can you write a note that says I don't have COVID? Well, I can't necessarily write a note that says what I can say is that whether or not you're fit for duty. And so you can require that your employee have physician notes that certifying that they're fit for duty, and that's totally acceptable. But we try and get out of the business of saying that people don't have COVID or have COVID, because that's it's a slippery slope with regard to how that information can be used or interpreted. So it's really important to make sure you're clearly you have conversations with your employees. Oftentimes, as a provider, I am asked to document that a certain patient may have health conditions that put them at risk for complications of COVID, that they have, let's say, some underlying pulmonary disease, and so that they should be home or should be not working. And we really don't think that that's our role. Our role is to just maybe provide the employer with the information that they need, that the employee has a documented health condition, but we completely leave it up to the employer on how to handle that. And I'm not in the business as a physician to dictate to employers how they run their business. And so, but those are some of the pitfalls that we fall into as providers providing guidance to patients regarding going back into the workplace. Next slide. And then below are some resources that might be useful to employers with regard to how to navigate through the ADA, the CDC, Department of Labor, so that they can make informed and educated worksite policies. And I'll move on to the next slide. So one of the things that we're seeing with COVID is really its impact on mental health and emotional well-being. And the reality is that 93% of employees believe that companies that survive COVID-19 will be those that support their employees' mental health. So how do we respond to that is going to be really important with regard to creating a safe and effective workplace for the employee. And we have to anticipate there is going to be a surge in mental health symptoms. I'm certainly seeing a lot of patients with anxiety. They may have been furloughed or lost their job, or they have family members that have succumbed to COVID or are currently ill, and this is really taking a toll psychologically. And this translates into the workplace. There may be less productive employees, and we have to think about that. A more holistic approach to these issues and to our employees. Next slide. So I've touched on some of this that we see patients or employees now that really have been affected mentally and psychologically because of social isolation. They may have underlying anxieties coming into it. There's this uncertainty that exists. The routines have certainly changed now. There's a lot of financial stress. They may have lost someone, COVID. And the other thing that we're seeing is increased substance use. There's been a lot of time at home for employees, and I've had many patients come in and tell me that their substance use has gotten a lot of control since COVID-19 started. And it's a way that they self-medicate themselves to get through it. And not necessarily a great way of approaching it, but it definitely exists, and it's something that's taking place, and we need to address it and make sure that on the work site, we're also thinking about it and having those conversations with our employees. Next slide. If you're in the healthcare industry, there are, and the first responders and healthcare workers, essential workers have really seen high levels of stress, burnout, PTSD. I certainly am seeing it and feeling it with providers that I work with. Virtual workers, there's this social isolation that has existed for the last several months. While that benefits some, there's a whole host of people that are very social, and they feel completely isolated from their work site, their workplace, and it's going to take a toll on them psychologically. And then there's these furloughed or laid off workers that are just uncertain about their futures, and we have to be thinking about how we can approach that. Next slide. So what can we do for the planning of this next new normal is just to ensure that there's robust mental health services. And if you offer a health plan that has good coverage for mental health, you want to make sure that your employees are utilizing that service as best as they can. If you have an EAP service, you want to make sure that the employees are aware and understand how to utilize these benefits, with regard to work-life services or support. So let's make sure that we are thinking about that as well. And then provide the self-care tools for resilience. There's things that employees can do at home, at the workplace to help take breaks from what's going on in their daily routines and lives, and if we can make an effort to make them feel supported, I think it goes a long way into mitigating some of these psychological effects that COVID is taking on our employees. Next slide. We want to make sure we're building and reinforcing a healthy workplace. Let them know that mental health is very important, and that there's no stigma associated. A lot of patients today still fear a stigma associated with mental health, and we got to break these barriers down along those lines. We want to make sure we're employing a workforce health strategy that involves regular exercise, good eating, stopping smoking, improving sleep, and lowering stress. We also want to make sure they give the employees feel a sense of purpose that in their work that they do, so that there's shared meaning, and they can promote strong connections. And I think that's going to be really important to get through this as well. Next slide. And I'll quickly go over these next few slides. At Kaiser Permanente, we really feel this is integral to our success is employee mental health, and making sure that they understand the resources they have. When we see patients, we screen them all the time for mental health, even if they're here for something unrelated. We ask them about substance use, depression, anxiety. We provide them with depression care management, case management in case we identify something or they screen positive. We have mental health capabilities via our telehealth platforms, offer group therapy. And so it's really important. So it's not so much that you address this at the workplace, but that you have a healthcare partner that also you can work with to address it. Next slide. And I'll skip over this next slide as well. Great. So here in a nutshell, this is really where we are. The framework for a psychologically healthy workplace is just to understand that there's going to be an impact, that you ensure that there's robust care options, whether it's at the workplace or through your partnerships with your healthcare partners. Break the silence, talk about it. Don't let it fester, and just know that it exists. And then you want to make sure you're building a culture of well-being. Okay, next slide. Thank you. And I'll move on, we'll skip over, we'll go to the next slide. It's just, these are some resources that can be found on a digital mental health wellness resources. Next slide. Yeah. Alcoholics Anonymous, Al-Anon. There's certainly a lot of addiction that is coming to hold with COVID. So we want to know that where to go and what resources we can give both employers and employees so that they can navigate through these healthcare challenges that they may face. Next slide. You know, one of the things that we've seen with COVID is an increase in domestic violence and in child abuse since COVID started, with patients or people having to be home, isolated at home. They didn't have necessarily an outlet or an escape from their traumatic homes or home lives, and so we've seen an uptick in these unfortunate events, and so having information available to our employers so they can give to their employees regarding how to access care and treatment for these conditions or safety for these conditions is key as well. Next slide. Thank you, Peter. All right, there's a lot of emphasis and a lot of energy going into addressing the social drivers of health, or previously we called it social determinants of health, and how COVID-19 really has been impacted by it. You know, nearly 2 in 3 Americans believe that the economic impact will have a bigger impact on them than the virus itself. And we saw that play out over the last several months, where at some point we are having to make a decision on is, you know, what are we doing? Is the virus causing more of an issue than the people out of work, and because of the economy and all the public health interventions that took place in March, April, and May? And now we have to really be aware that people are thinking that their economy, the economic impact is actually is probably more, it weighs heavier on their minds and souls. Next slide. Whenever you have any condition, you always think about what are the social drivers that account for health outcomes. And the social drivers account for 40% of health outcomes. And this is, you know, access to education. Do you have a job? Where you have a strong family social network? Is your income levels are adequate enough to sustain a healthy living practice? Those are social drivers of health, are the conditions in which people live, work, and play, and they account for about 40% of the health outcomes. And as opposed to just really what's healthy behaviors. Now, healthy behaviors are important too, like do you smoke, do you eat right, do you exercise regularly? You know, they account for about 30% of health outcomes. Healthcare, as much as I like to take as much credit for keeping my patients healthy, it really only accounts for 20% of health outcomes. So all these interventions that we do in the healthcare space really are just meant to just operate in the fringes realistically, because you're looking at 80% of their health outcomes are driven by things that I can't control as a physician, and most of these being socioeconomic and healthy and their patients' health behaviors. Next slide. So it's going to be important as we understand that we had COVID-19 took a toll. People have had a significant loss in salary, and they now having to pay bills and trying to figure out how they're going to navigate through this. They may have lost health insurance, and so now they're working on how to care for, if they have members of their family with chronic conditions, how are they going to get access to care for their family if they've been furloughed or laid off. The workers that are low wage tend to be particularly vulnerable. And then there are food, housing, and other unmet needs that are acute for the employees. that were even predated COVID-19, and now they have to prioritize their social needs over healthcare. I see this often where patients will not obtain care because they can't afford it, because they have to make sure that they have enough money for food provide for their family. And so these are the social determinants of care, and it's going to be important to just acknowledge that and also addressing it. Next slide. So, it's going to be important to identify, who are the employees that are really struggling with these needs, and you may want to look at who's accessing their 401k retirement funds early, who's asking for early paycheck release, what's the EAP utilization in your workplace. So these are the methods that we as employers can use to figure out what are our employees experiencing. And maybe they're not willing to talk about it, but this is how they'll present to you. And it's going to be really important to get a handle on it and find some strategy to deal with it. Next slide. So we may want to talk about what are we going to do to optimize EAP services in your workplace. Other financial services that you can offer that'll help from your financial vendors that can show how to budget, how to manage debt. So you can consider hosting webinars for your employees to help them navigate through this, because if you can tackle it early, you can get a handle on it before it becomes a bigger problem. And there's community resources that you can use that'll help patients or employees navigate through this as well. Next slide. Thank you. You also want to make sure you're reviewing workplace policies to address the social and economic needs. There's a lot of flexible work scheduling. Working from home has been key. Having the ability to work from home has been key. And I see that as with the uncertainty of what's going to happen after the summer ends, having 2 children of my own, not knowing, are they going to be going to school, or are we going to be homeschooling them or having to be home? Are our employers flexible enough to allow for some flexible work scheduling, maybe at hours that are more convenient, so that people can effectively manage through this? And that's going to be key. Then you want to look at caregiver benefits, navigate leave of absence policies, and having flexible policies that are available to all our workers. Next slide. Thank you. There's definitely some workers that have been furloughed or terminated or laid off, and it's going to be important to help support them navigate through their health insurance options. You may want to consider having conversations around COBRA so that they don't float through this space with no health insurance. And if they get COVID, or if there are other disease burden like heart disease or heart failure or cancer, we don't want to let them float and not have the ability to get care and get treatment just because they've been laid off work. So we want to make sure we set up a benefits review, help maybe assist them finding a new job. That's going to be key to help getting them through this very difficult time. And then lastly, in the next slide, is it helps when you can find a way to support your community, whether it's through philanthropy, social responsibility, and organized activity, volunteer activities. I think that helps give that meaning of sense of purpose for our employees, and rallies them around a greater good, and it can help provide improved teamwork and for your employees. These are all helpful things you can do in the workplace. All right, and then in the next section, this is really not my area of expertise as HR policies, but we provided a few key things you may want to think about. You want to review and update your HR policies to reflect really what the next normal is going to look like. And I think, Peter, I want to stop because we're 5 minutes to go, and I want to make sure I have the ability to answer some questions.
No worries. Thanks, Dr. Raigosa, for that. I was going to say, because we are running short on time, if you would like, we can just do a quick run through on this, and then I can collect any and all questions that do come up, and then I can send them your way and we can get the answers to those. But if you'd like, we can just do a quick run through on this and then wrap it up, if that's easier.
We can do both too. Let's do a quick run through.
Did you want to finish with this part of the presentation?
Oh, no, I'm good. I'm ready to take questions.
Okay. So if you have any questions, go ahead and send them over using the questions feature on that in your control panel. If you see it to the right, you'll be able to send them over, and then Dr. Raigosa will go ahead and answer them.
Thank you. Peter, I think it'd be good also for me to mention that this presentation will be available for the participants, and I've also included some industry-specific interventions that you can employ with certain industries that to help you navigate through COVID a little more effectively.
Dr. Raigosa, one of the questions I have is, there was one section that you had a checklist kind of on everything that businesses should have to be ready. Does Kaiser have, a sheet like that that can be sent to the businesses for them to, either put up in their employee break room or to have as a checklist for them to hold on their own?
I can certainly look at that to see if we have anything that we can distribute. So we'll I'll have to get back to you on that, and certainly if we have it, I'll make sure we provide it.
Perfect. So then I'll turn it over to you again. I know we're kind of close on time. I'll turn it over to you to wrap it up, and then I know we won't go through it, but if you wanted to quickly run through the appendix, if you wanted to let people know when we do send the presentation out what they can find there.
Right, thanks, Peter. So again, I want to thank you all for the opportunity to be here and to talk about COVID-19 and give some updates on really what it's about and what we can do from an employer level to help our employees improve their health outcomes and mitigate their risk, and to just deal with all the issues surrounding COVID-19. I know I'll leave it at that. In the appendix, there's specifics on it, all the major industries, and I think I will, I don't want to necessarily go through all of them, but they'll be available, and they're for our chamber members to work through, and if they see that it fits them, then maybe there's some intervention they can try. So again, thank you for the opportunity, and I'll give it back to Peter for final thoughts.
Thank you, Dr. Raigosa. This was great, and we're thankful to have Kaiser bring this information to our business community. Again, we will be sharing the presentation with everyone as you review it. If anything comes up, please go ahead and email us, hello@scvchamber.com, if you have any questions. We'll get them over to Dr. Raigosa and try to get them answered best. Again, don't forget to check out our events page for future events we've got coming up this week and in the next few weeks. With that, please be safe and healthy, and we look forward to seeing you at our next webinar. Thanks, everybody.